Hello students, we will discuss about a condition which is very common in developing countries like us and anywhere. So see what this condition is. Look at that oral cavity, you can see ulcer here. It's ulcer with a proliferation edge. Some proliferation is there in the edge. Ulcer is there in the posterior half of the buccal mucosa. See that extending like this. So posterior half of the buccal mucosa, probably extending into the upper alveolus and abutting posterior of the lower alveolus also. So what is this condition? All of you know that is proliferative lesion in the buccal mucosa of oral cancer. Oral cancer is a main question in theory, and examination also they will be kept as a short case or long case. You have to examine oral cavity properly from the lip, floor of the mouth, tongue, buccal mucosa, alveolus upper and lower, posterior third of the tongue from behind, and you have to palpate also same way. Tonsils also, posterior also, if required, to palpate. When you palpate such ulcer, look for tenderness, induration, and posterior extension, alveolar involvement, and loose teeth also you have to look for, and bone thickening, mandibular thickening, and maxillary thickening suggests the infiltration. That also should be examined. So examine in detail oral cavity, and always examine the neck, level 1, 1A, 1B, 2, 3, 4, 5, neck memorial stone catering classification accordingly, and mention it is always. And systemic exams is a must. Lung, mainly respiratory system, of course other system. So all oral cancers are usually loco-regional disease. It can have a systemic disease when there is immunosuppression, elderly people, or HIV patient, and so on. So that is about oral ulcer. Just see, there are a few things here I just want to highlight. What is pre-malignant lesion? It is cancer more likely to occur. Leukoplakia, erythroplakia, chronic hyperplastic candidiasis are the pre-malignant lesions. Pre-malignant conditions are little different, meaning wise they are increased risk. There's only increased risk. There is submucosal fibrosis, syphilitic glossitis, and pseudoprene dysphagia. And these are the most important. It's the more likely turn into cancer. The increased risk, these are the high risk. And remember, all the S factors, all of you know that, all books mention that syphilis, sharp tooth, glossitis, superficial glossitis, all different yes, 5, 6, 7 X's are there in all books, it's mentioned. Remember those, yes, it will be asked in the Y or Oxy, they may ask. And current terminology is not lesions and conditions combined together as a pre-malignant disorders as far as WHO is concerned. So remember the meanings of pre-malignant lesions, pre-malignant conditions, and current terminology pre-malignant disorders. And remember these points about oral cancer. Human papilloma virus, common involvement. Tobacco chewer is the most common cause. Assess primary lesion. Neck, examine the neck. Wedge biopsy from the edges. And neck ultrasound, CT, head, neck, chest, and plan the therapy. This table is very, very important, remember. And so that is about oral cancer. Answer this MCQ. Most common site of Kaposi sarcoma in the oral cavity. Rare, but becoming common because of the incidence of AIDS and HIV. And it is common in HIV patient, Kaposi sarcoma in oral cavity. So what is the common site? The floor of the mouth, dorsal of the tongue, lower alveolus, palate. So find out the answer, which is the right answer, and put it on the comment. Then eventually I will put the answer. So go through my clinical methods in surgery, manual of surgery in detail about oral malignancies, oral cavity lesions, and my operative surgery for oral malignancies, and of course begin our lecture through JP publishers in detail. All such topics I have covered, including operative surgery, X-rays, specimens, and specialties also. So students, I hope you understood this lecture very well, and please go through the MCQ and comment with the answer for the same tomorrow. Thank you very much.